In this video, we'll explain an alternative method to enrolling a new patient using the Center for Addiction and Mental Health STOP program online portal. To enroll a new patient, you can click the Enroll New Patient Client button located at the top left corner of the dashboard as described in the previous video. Or, you can click the Patient Client tab at the top right of the page and select Enroll New Patient Client from the drop-down menu. This will open a new page. Select the baseline survey you wish to use with this patient from the drop-down menu and enter the patient's first name and last name in the appropriate text boxes. Click the Search button to check if the patient is already in the system. If the search results in No Record Found, click the New Patient button at the bottom of the dialog box to create a new patient file. You will then be prompted to set the date. You can set today's date by clicking the Set Today's Date button. You can also select a different date by using the drop-down calendar that appears when you click on the blank field. Once you have selected the date, click on the Set button. The system will now direct you to the Consent section. At the top of the page, you must create a new patient number manually in the text field. The client ID number is based on your organization's procedure for creating a unique identifier for clients. It's important to get the patient's consent before they can participate in the STOP program. Consent forms are also to be completed in hard copy first, as per the instructions in the resource binder for practitioners. If they consent, click the checkmark icon. If they do not consent, click the X icon. Once you have filled out the patient's general information on the Consent Form tab, you can advance in the survey by clicking the Next button located at the bottom right. The next tab is the Registration tab. This part of the survey asks for further mandatory patient information and details related to their tobacco use. At the bottom of the Registration tab, you'll be presented with two options. Option A allows you to continue the baseline survey, and Option B allows you to have the client complete the survey later and will take you directly to the Visit form. Let's go directly to the Intervention form, aka Visit form, by selecting Option B. Other baseline information will need to be filled out on the paper copy and sent to CAMH monthly. Have the patient answer the questions on the Intervention form. Once you have filled in the questions, click the Next button located at the bottom right of the page. This will take you to the End, General Comments and Follow-up tab. If you, as the practitioner, are prescribing nicotine replacement therapy for the patient, answer Yes to the first question on the End, General Comments and Follow-up tab. This will open a new dialog box that should be answered before moving on. Please note that the kit options are found on a different tab from the individual NRT options. Enter the length of treatment, number of boxes of medication, and the lot number of the medication in the appropriate fields. Please note that you cannot dispense more than 4 weeks of medication to clients at one time. The only exception to this rule is the kit which is meant for 5 weeks of treatment and should be recorded accordingly. The maximum allowable limit within a calendar year is 26 weeks of NRT per client. Click the Finish button at the bottom right corner to return to the patient's profile. At this point, the total number of NRT dispensed to this client will be automatically updated and displayed in the top left corner of the patient's profile.